Hello coders! Welcome to Fast Coder 21 free medical coding YouTube channel. In today's session, we are going to learn how to select accurate principal diagnosis in inpatient coding with scenarios. As all of us know, in inpatient coding, principal diagnosis is the most important step while coding the inpatient records. In this session, we are going to learn all ICD-10 2023 guidelines along with few example scenarios related to selection of principal diagnosis in inpatient setting. If you are visiting for the first time, please click on subscribe button to receive future updates. If you want to code inpatient code or inpatient record properly, please watch this video until the end. Please learn, like, comment and share. First, we will learn what is principal diagnosis. So the principal diagnosis is defined in the Uniform Hospital Discharge Data Test Set. Usually we will call it as UHDDS as that condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. So basically in this definition we need to identify the keyword after study. So the condition established after study. So after admission of the patient to the hospital, physician will perform the studies and after the study, physician will decide what is the main reason for the admission. That will become the PDX or principal diagnosis. So we have an example here after study example. So here a patient is admitted with unstable angina, but a diagnostic cardiac catheterization with coronary angiography showed that the patient principal diagnosis is coronary artery disease. So basically patient has admitted with unstable angina, but after study here basically physician perform diagnostic cardiac catheterization with coronary angiography. These are the studies in order to find the correct diagnosis which the patient have. So here physician found patient has coronary artery disease. So here principal diagnosis will be coronary artery disease which was found by the physician after study. Next one, what will take precedence while selecting principal diagnosis? So here while selecting the principal diagnosis, coding conventions in the ICD-10 CM, the tabular list and alphabetic index take precedence over these official coding guidelines. So we need to follow the guidelines which are mentioned in the tabular list and alphabetical index before using the official coding guidelines. Now we will learn the original guidelines from the CMS. So here selection of principal diagnosis. Our first guideline is codes for symptoms, signs and ill-defined conditions. So basically codes for symptoms, signs and ill-defined conditions from chapter 18 are not to be used as principal diagnosis when a relative definitive diagnosis has been established. So for example here patient has abdominal pain due to appendicitis. So basically abdominal pain is the symptom of appendicitis. So based on guideline, whenever we have symptom and definitive diagnosis, we need to code the definitive diagnosis instead of symptom. So here our PDX will be appendicitis, which is the definitive diagnosis. Next guideline is two or more interrelated conditions, each potentially meeting the definition for principal diagnosis. So here keyword is interrelated. So these both conditions are interrelated with each other. So when there are two or more interrelated conditions such as diseases in the ICD-10 CM chapter or manifestations characteristically associated with a certain disease, potentially meeting the definition of principal diagnosis, this is the important here. Either condition may be sequenced first unless the circumstances of the admission, the therapy provided, the tabular list or the alphabetic index indicate otherwise. So whenever there are interrelated conditions find in the document, we need to check circumstance of the admission, therapy provider, and we need to follow the tabular list and alphabetic index guidelines. So here we have one example. A patient presents with bleeding esophageal varices and active cirrhosis of the liver. Okay. The coding instruction of code first underlying disease requires the code for the cirrhosis be reported first, followed by the code for bleeding esophageal varices. So, even though these are interrelated conditions, they equally meet the definition of principal diagnosis. We need to code for the cirrhosis is listed first because the ICD-10-CM index indicates sequencing. So, codes assigned are K7460 cirrhosis of the liver and IIT 85.11 bleeding esophageal varices as the second code. So, whenever we code two or more interrelated conditions, we need to follow the alphabetic index and tabular list, and we need to find the sequencing decision. Basically here the tip is, as a coder, we need to sequence first when either code can be reported. We need to code the code which is having the highest payment from a payer. So our next guideline is two or more diagnoses that equally meet the definition for principal diagnosis. So in some situations, when two or more diagnoses equally meet the criteria for principal diagnosis as determined by the circumstance of admission, diagnostic workup, and the therapy provided, and the alphabetic index tabular list or another coding guidelines does not provide sequencing direction, any one of the diagnoses may be sequenced first. So when there are no guidelines related to the sequencing decision, we need to select any one of the diagnoses when we have two or more diagnoses that equally meet the definition of principal diagnosis. Here we have an example. We will learn using that example. So here patient was admitted from ED with SOB, leukocytosis, tachycardia, wheezing and left lower lobe infiltrate on X-ray. Okay. Patient's oxygen saturations were in the low 70s and started on BiPAP. So the patient was admitted for acute respiratory failure due to COPD exacerbation and pneumonia. So treatment consisted of nebulizers, IV steroids and IV antibiotics. So the patient required BiPAP and was weaned to oxygen during the hospitalization. The patient was set up with home oxygen and discharge. So in these scenarios, two diagnoses are equally meet the definition for principal diagnosis. So here we can code anyone as the PDX. Our next guideline is two or more comparative or contrasting conditions. In some instances, when two or more contrasting or comparative diagnoses are documented as either or, they are coded as if the diagnoses are confirmed and the diagnoses are sequenced according to the circumstance of the admission. So whenever we have comparative or contrasting conditions, we need to check the circumstance of the admission. If no further determination can be made as to which diagnosis should be principal, either diagnosis may be sequenced first. Here we have an example. A patient presents with dizziness. The physician documentation supports the diagnosis of benign positional vertigo versus labyrinthitis. So here we need to put both diagnoses. So, but to dizziness is related to the benign positional vertigo, we can code benign positional vertigo as the PDX and labyrinthitis is the secondary diagnosis. So our next guideline is original treatment plan not carried out. So what is the guideline here? Sequence as the principal diagnosis the condition which after study occasioned the admission to the hospital even though treatment may not have been carried out due to unforeseen circumstances. So basically the logic here is we need to, if the original treatment plan is not carried out, we need to code the condition which was found by the physician after study. Here we have an example. So a patient is admitted for coronary artery bypass surgery to treat coronary artery disease develops a fever prior to surgery. Okay, so before the surgery, patient has fever. The surgery is cancelled and the patient is discharged. So in this case, the coronary artery disease is sequenced at the principal diagnosis, followed by a code for the fever and code to indicate that surgery was cancelled due to a contraindication Z5309. And ICD-10 10 cm procedure code is not reported because surgery was not done. So basically, as per the ICD-10 cm guidelines, when there is or when original treatment plan is not carried out, we need to code the diagnosis which was found by the physician after study. In our example, so coronary artery disease is the condition found by the physician after study. So we will consider CAD as the principal diagnosis and fever as the secondary diagnosis. Next guideline, complications of surgery and other medical care. So when the admission is for treatment of a complication resulting from surgery or other medical care, the complication code is sequenced as the principal diagnosis. So basically, when there is a complication due to or resulting from a surgery, we need to code the complication as the PDX. If the complication is classified to the T82, T88 series, and the code lacks the necessary specificity in describing the complication, and additional code for the specific complication should also be assigned along with T82, T88. So here we have an example. So here basically whenever there is a complication due to the surgery, we need to code complication as the PDX. So if we are coding using T82, T88 series, if those codes are not unable to include the complication, we need to code separate code for complication. So here we have an example. So patient has post-operative hemorrhage in the tonsillar fossa following tonsillectomy. So basically patient had tonsillectomy and patient has post-operative hemorrhage. So basically after tonsillectomy patient has hemorrhage. Course reported will be J95.830 complication hemorrhage respiratory system and the external cause code Y83.6 for the abnormal reaction to removal of an organ. So basically because of removal of the organ, patient has hemorrhage. So we need to code it as Y83.6. Next one, uncertain diagnosis. So basically when there are words like probable, suspected, likely, questionable, possible are still to be ruled out, compatible with, consistent with, like terminology if we found in the inpatient setting, we can code those condition as existed. So basis for that is diagnostic workup, arrangements for further workup or observation, and initial therapeutic approach that correspond most closely with the established diagnosis. So basically this guideline is applicable to only inpatient setting, not for outpatient setting. So here we have an example, nausea and vomiting, gastroenteritis ruled out. So here ruled out means physician did not confirm patient has gastroenteritis. So here we need to code only the nausea and vomiting as gastroenteritis was ruled out. Ruled out means there is no gastroenteritis, patient has only nausea and vomiting. Our next guideline, admission following medical observation. So when a patient is admitted to an observation unit for a medical condition which either worsens or does not improve and is subsequently admitted as an inpatient of the same hospital for the same medical condition, the principal diagnosis would be the medical condition which led to the hospital admission. So basically when patient is admitted to an observation unit for a medical condition, the condition which necessitated the admission to inpatient setting will be the principal diagnosis. So we have one guideline, admission following post-operative observation. We have an example here. So a patient is admitted to the observation unit following severe pain from a tonsillectomy. Okay. Pain is controlled in the observation unit, but the patient develops post-operative hemorrhage and requires admission to the hospital. Okay, the post-operative hemorrhage is the principal diagnosis because it is chiefly responsible for occasioning the admission. The diagnosis of tonsillitis and the procedure for tonsillectomy also reported. So basically, pain is controlled in the observation unit. So, but because of post-operative hemorrhage only, patient got admitted into the inpatient unit. So here, our principal diagnosis will be post-operative hemorrhage, not pain. So our next guideline, admission from outpatient surgery. So basically, if the reason for the inpatient admission is a complication, we need to assign the complication as the principal diagnosis. So here we have an example. Ralph undergoes inguinal hernia repair. After surgery, he is admitted due to postoperative fever. The principal diagnosis is the post-op fever followed by the diagnosis code for the left inguinal hernia. Here we need to assign code for the inguinal hernia as well as the external cause code. So basically what happened here, patient has post-operative fever. So whenever there is a complication because of the procedure, we need to code complication as the PDX followed by the diagnosis for which the patient has had the treatment. If no complication or other condition is documented as the reason for the inpatient admission, we need to assign the reason for the outpatient surgery as the principal diagnosis. So if the reason for the inpatient admission is another condition unrelated to the surgery, assign the unrelated condition as the principal diagnosis. So based on the reason for the admission, we need to code the principal diagnosis. Next guideline, admissions encounters for rehabilitation. When the purpose for the admission or encounter is rehabilitation, sequence first the code for the condition for which the service is being performed. So here we have an example. So for an admission for rehabilitation for right-sided dominant hemiplegia following a cerebrovascular infarction, we need to report the code I69.351 hemiplegia and hemiparesis following cerebral infarction affecting right dominant side as the first listed or principal diagnosis. So basically here patient is admitted for right-sided dominant hemiplegia following a cerebrovascular infection. So patient is admitted for rehabilitation in order to cure from hemiplegia. So here hemiplegia will become the first listed or principal diagnosis. So if the condition for which the rehabilitation service is being provided is no longer present, report the appropriate aftercare code as the first listed or principal diagnosis unless the rehabilitation service is being provided following an injury. For rehabilitation services following active treatment of an injury, assign the injury code with the appropriate seventh character for subsequent encounter as the first listed or principal diagnosis. So here we have an example. For example, if a patient with severe degenerative arthritis of the hip underwent hip replacement and the current admission is for rehabilitation. Here we need to code Z47.1 aftercare following joint replacement surgery as the first listed or principal diagnosis. So if the patient requests rehabilitation post hip replacement for right intertrochanteric femur fracture, we need to report the F72 series code. So basically here we need to identify reason for the rehabilitation. So whatever it is the reason, we need to code the diagnosis which necessitated for rehabilitation as the principal diagnosis. Thank you guys. Thanks for visiting Fast Coder 21. Please like, comment and share and subscribe our channel to fellow coders.